Hi guys, Heather here. So sometimes things occur in the hospital that we don't really want to happen. For instance, your patient falls on the floor during your shift. Maybe they fell out of bed or a chair, or they got lightheaded or dizzy when walking to the bathroom. And it gives you kind of like this nervous feeling, and your heart might race a little because you feel kind of bad that they fell out of bed on your watch when you were supposed to be the one protecting them from harm. But you know, it happens. So what do we do in that type of situation? Well, first the nurse assesses for physical signs of injury, like bleeding, a developing hematoma, mental status. We take their vitals. We ask if they hit their head or they're having any pain. We call the doctor. And at my hospital, we actually have to leave the patient on the floor in the most comfortable position possible, giving them at least a pillow, until the doctor comes up and sees them and assesses whether they might have a C-spine injury. And then we can get the patient back to bed once cleared by the doctor. If the patient hits their head, they'll usually have to have a CT scan of the head to rule out a brain bleed. And if there's suspected neck injuries or hip injuries, they'll have an x-ray of that area as well. And also, if there's a suspected neck injury, the patient might have to wear a neck collar until cleared by the doctor or the test results come back negative. Usually the patient doesn't get severely injured when they fall, other than maybe like some scrapes or bruises. But even if they don't get injured, we still have to write an incident report, guys. And this incident report describes the patient incident, who witnessed the fall, what doctor was called, and the patient outcome. And then this form is posted on the wall for everyone to see with the nurse's name in bold letters. Totally kidding. So, the best thing to do to prevent your patient from ending up on the floor is to take measures to prevent patient falls. And we do this by using bed alarms, chair alarms, having a safety attendant at the bedside if needed, checking on them every hour to assess their needs such as toileting, making sure they have something to drink and whatever else they may need. So, preventing falls is preferable to keep your patient out of harm's way. Well guys, thanks for watching. I'll talk to you soon, okay? Bye!